You've probably seen someone blow out a thick cloud of sweet-smelling vapor and thought, at least it's better than smoking. But is vaping really just vapor, or are we just trading one danger with another, cleverly marketed as fun and harmless? Hi, I'm Dr. Rehan Pradhan, MD Internal Medicine, and today I'll be dissecting the truth behind the clouds, the science and the health risks of vaping. Vaping has become a global trend with over 80 million users worldwide. No wonder vape earned the title of the Word of the Year in 2014. E-cigarettes or vapes are battery-powered devices that heat a liquid into an aerosol which is then inhaled. Hence, vaping is a misnomer, as it's just not a vapor, but gaseous mist of chemicals. It has evolved over time and is classified as generations. First generation vape look like regular cigarettes called cig-likes. Since there is no burning of tobacco, many believe vaping as safer alternative to smoking. However, that's only partly true, as traditional cigarettes are incredibly toxic, causing over 8 million deaths annually, and e-cigarettes aerosol may not include all the contaminants in tobacco smoke. But does 1,000 deaths mean safer than compared to millions of deaths? There's growing evidence that vaping may be even more harmful than smoking. Nicotine derived from tobacco acts on the brain's mesolimbic dopaminergic system, the same system involved in survival behaviors like eating. This tricks the brain into treating nicotine as a false sense of necessity, which is the essence of addiction. In reality, nobody keeps on smoking anything if there is no nicotine. Limited evidence indicate that e-cigarettes are less addictive than smoking. The latest 4th generation pod mod devices use nicotine salts rather than freebase nicotine. These salts are smoother on the throat, making higher doses more palatable. To put it into perspective, a Juul pod less than 1 ml contains as much nicotine as a pack of 20 cigarettes. Besides nicotine and flavoring, the main ingredient of the aerosol are glycerin, propylene glycol, and many toxic substances. Some also use cannabinoids, which are substances derived from plant of the genus Cannabis instead of nicotine. Some additives, when inhaled, may cause irritation and acute lung damage. In 2019, hospitals across the United States saw a spike in mysterious deadly lung disease, with patients presenting with severe shortness of breath, chest pain, and fever. CDC named it EVALI, that is e-cigarettes or vaping-associated lung injury. It led to thousands of hospitalizations and dozens of deaths. Many of these cases were linked to vitamin E acetate in THC, that is tetrahydrocannabinol, but nicotine-only vapes were also implicated. Vitamin E, a commonly used oral supplement, is used as delivery agent that might act as an irritant when inhaled. Don't be fooled by the sweet scent. Vape aerosol contains a toxic cocktail of acrolein, which damages lung tissues, nicotine and THC, which are addictive and hardwire your brain, formaldehyde, a known cancer-causing chemical, and heavy metals like nickel, lead, and chromium. In fact, a 2021 study published in Tobacco Control found metal levels in vape aerosol comparable to or even higher than cigarettes. Some flavoring agents like diacetyl are linked to a disease called popcorn lung or bronchiolitis obliterans, a form of irreversible lung damage which was first seen in popcorn factory workers exposed to diacetyl. We don't yet have 20 or 30 years study for vaping like we do for smoking, but the damage goes beyond lungs. It has been associated with increased anxiety and depression, possibly due to nicotine's effect on neurotransmitters. Several studies show that vape users have increased DNA damage in their oral cells, possible precursor to oral cancer. Oral health also suffers with increased gum disease, dry mouth, and mouth ulcers. Sudden cardiac death and heart failure has been associated with vaping. Secondhand vaping can affect people nearby, especially children and pregnant females. Also, keep e-liquid away from children, as it is always at high risk of getting accidental poisoning. Does vaping help you quit smoking? Results from majority of latest research contradict the main selling point of vapes, advertised as safer alternatives to be used by those wanting to quit smoking. While some adult smokers have used e-cigarettes to quit, many become dual users, continuing to use both cigarettes and vapes, stacking risks on top of risks. Although officially aimed at an adult audience, vaping is marketed directly to youths. With exotic flavors of fruits and candies, these are not targeting adult smokers trying to quit smoking, rather are baiting teenagers and young adults. A 2022 study found that more than 80% of teen vapers started with flavored products, and once hooked by nicotine, quitting is an uphill battle. Nicotine can interfere with brain development, memory, attention, and emotional regulation in young users. The US Surgeon General even declared youth vaping as a national epidemic in 2020. When millions of young, healthy, never smoked individuals take up vaping, we are facing a new generation public health crisis. So what's the bottom line? Vaping is not a harmless alternative, rather an unhealthy trend, potentially renormalizing smoking. It is a new form of addiction wrapped in slick packaging, gadgets, and sweet flavors. Inhaling chemicals into your lungs, no matter how fruity or fun it tastes, can be deadly. And remember, clear lungs need clear choices. If you found this video helpful, like, share, and subscribe for more evidence-based health insights. Comment below, would you prefer the flavor trap or instead enjoy the vape-free flavor of healthy life? Thanks for watching. Stop vaping, stay healthy, and I'll see you in the next video.